Welcome to CHFT's Electronic Patient Record Training for ED Doctors. This e-learning will show how to navigate around the system, how to customize and save favorites for your personal login, where and how to record patient care on the patient record, how to create a document and how to discharge the patient. The patients used for e-learning are on a trained domain, and are totally fictional. This is part 3 of 4 sections for ED doctors. Part 3 covers the following: new order entry, creating favorite folders, quick orders, documentation, sign and submit, auto text, viewing documentation, prescribing and IVs, drug-to-drug interaction alerts, medication administration record, modifying, suspending and cancelling, insertion of cannula, hotkeys, medication administration, specimen collection and removal of cannula. Now we will look at ordering requests for the patient, for example blood tests. Note: medication should not be ordered through new order entry. Quick orders or requests and care plans should be used. We will look at these later. Click on New Order Entry from the menu. Start typing in the search field. For this example we will type FBC for full blood count. Click to select. You can order several things at once before signing for them. Let's type LFT for liver function test. Click to select. We will type XR for X-ray. If you hit the Enter key on your keyboard, it expands the list to save from scrolling. Click on Order. The last one for this example is to type Refer for referral. Again, hitting Enter on the keyboard will expand the list. Click on Order. All orders sit in the green basket. You may have noticed the numbers going up as we were ordering. Click on the basket. Orders for signature appear in the window. We have 4 orders. You may need to scroll to see all orders. Click Sign. Click OK to Ordering Clinician. Orders appear in categories. The blue circle denotes that clinical information is required before the order can be signed off. From here you can create favorite folders for frequently used requests. Right-click on an item. Click Add to Favorites. Click New Folder. Give the new folder a name. Click OK. To use your favorites folder, click on Mine when ordering. The folders you create will appear in a list. Click on the folder you require. Click on Order for each item required. If you are on the ED Clinical Notes page, you can use the Quick Order tab. You can order ECGs, labs, radiology and medications from this page. To add anything else, you can click to navigate to New Order Entry. We will order the FBC, LFT and the X-ray. Click on each item you wish to order. You can also use your favorites folder as they also appear on quick orders. The basket where the orders sit is also the same. When ordering is complete, click on Sign. Click OK. Whichever way you have ordered, you will navigate back to Requests and Care Plans where the orders sit awaiting clinical information and sign off. Orders are also categorized. You can complete information for more than one order at the same time if it is in the same category. Use your mouse to highlight the orders together. If required, use your mouse to drag up the window to make the order details more visible for ease of inputting. Complete order details. Both orders have details completed. Click on the blue circle to complete the next order. Use drop-downs where required. Scroll down if necessary to ensure all mandatory fields are completed. Anything bold with an asterisk is also mandatory. Ensure these fields are also completed. If you forget and click Sign before completing all orders, a prompt window will appear. Click on First Detail and the system will take you to the missing fields. Continue to complete the orders. Order details are now complete. Blue circles have disappeared. Click Sign. You can create notes by selecting the appropriate link from the menu. We will select an ED note. You can see the note has pulled through information from the patient record. If you wish to omit any categories, click the cross next to the title. You can free text into fields. You can also use auto text. Creating auto text can save time in the future with frequently used phrases, checklists and so on. You can copy and paste from other documents into auto text when creating them. Click on the auto text icon. Click on the plus. All auto text start with a punctuation. Give the auto text an abbreviation you will remember easily. For example, full stop, CEX for chest examination. Give your auto text an abbreviation name. For example, chest examination. Type your auto text wording. Or copy in from another document, into the body of the window. When completed, click Save. Click on the cross to close the auto text window. To use auto text, type the abbreviation you gave it. A list of auto text creations appear. Double-click on your auto text abbreviation. Your auto text has pulled through. Once you are happy with the document, click Sign and Submit. Save and close are only to be used if you haven't finalized your document and need to come back to it later. These functions will save the document so only you can see it. The Sign and Submit button saves it to the patient record. A window will appear. Check you have the correct type of document and other details have been completed, for example title. Click Sign. The system will take you to document viewing where all documentation sits. Refresh the page. Click on a document and it will appear on the right-hand side for viewing. We will now look at ordering medication. This has to be done via Requests and Care Plans from ED Launch Point by right-clicking on the patient name, or if you are in the patient record by using the main menu. Click Add. Type medication required. You will see a list of medication appear as you are typing, or after you have typed depending on the medication you are inputting. The list of medications that appear contain order sentences. These have been created using the most frequently used dosage, route, etc. and will save you time. If the one you require is not listed, choose the nearest one as you can alter details before signing for it. Or you can choose the single listing and complete all clinical details yourself before signing. The green circle shows our formulary medication and should always be used in the first instance. We will select an order sentence for paracetamol. Click OK. You will also find order sets. Order sets are logical groups of orders that are commonly used for specific admission, diagnosis, or treatment, rather than having to enter each order individually. For example, if we click on the ED pain adult order set and click Done, you will be presented with several options that you can then select from. Order sentences are also available within these order sets. Use the drop-down arrow to select appropriately. Whichever way you select medication, close the window by clicking on Done. We will go back to the order for paracetamol. The order appears with a blue cross. Remember that this denotes that clinical information is required before signing, and yellow fields, or bold and asterisked, are mandatory. Click the blue cross. You may need to scroll down to ensure all mandatory fields are completed. Complete the clinical details. Once you have input all clinical information, click Sign. Refresh the page. We will order other types of medications to run through the process again. Click Add. We will order tramadol. Refresh the page. We will now prescribe an IV. We will select an order sentence for sodium chloride 0.45% IV fluid 500 ml. Click Add. Populate the mandatory rate box. Click Sign. Next we will show how drug-to-drug interactions appear on the system. These are only set for high-level or significant reactions. Alerts appear when medication is ordered and interactions occur that are contraindicated when taken together. We will order morphine. Click Add. The interaction dialog box has appeared. Use the drop-down on the override reason to tell the system the action we are going to take. Scroll to see the full listings. Select appropriately. We will use benefit outweighs the risk today. Click on Continue. Click Done. We will complete the order, then click Sign. It is always advisable after prescribing to check the medication administration record, known as the MAR chart. Click on MAR from the main menu. Remember to refresh. All medications and infusions are now showing on the MAR chart. You can customize the layout by right-clicking on the gray bar. Select Change Search Criteria. Select Preferred Options. Click OK. If we go back to Requests and Care Plans, the orders are now sat in their respective categories. If you need to modify, suspend or cancel a medication, right-click on the order you wish to amend. Select the appropriate action you wish to take. You can also cancel and reorder if you have made an error after signing. Whatever action is selected, you will have to complete mandatory fields as to the reason for your action. We ordered an IV infusion for our patient. You have now inserted the cannula to administer the IV. You now need to record the insertion of the cannula. Click on Assessments and Fluid Balance. If you are on Launch Point, right-click on the patient name and select Assessments and Fluid Balance. Assessments and Fluid Balance has its own menu in the middle. It has different categories to select from. These are known as navigator bands. We need to select lines, drains and tubes. Select Peripheral IV Access. Double-click on the blue header to open up the timeline. Click on the graph icon and a form will appear. Complete the form. Click OK. Insert date and time. You can use hotkeys with your keyboard. T equals today. You can also use the first and last letters of the words week, month and year to input dates. If the time required is now, you can use the letter N for now. Click on Activity. Select Insertion. Input number of attempts. Input batch number. Input expiry date. Input your name. Click on the green tick to sign off the information. Now we need to record the administration of the medication. Click on Medication Administration on the top toolbars. You can also navigate to this from anywhere on FirstNet as the toolbars remain at the top. You are asked to scan the patient's wristband. This is to ensure we are recording on the right patient's record. If you are unable to scan, click Next. Confirm you wish to proceed by clicking on Yes. The administration wizard shows any medication due and/or overdue. Click the box next to the medication or medications you are administering. Medication highlighted shows a tick in the box and yellow to the right denotes information is required. Click on the medication under the result column. The administration window opens, showing mandatory fields. Some non-mandatory fields also require completing. You should always record in the administration type field. Click on the drop-down. Select the relevant answer from the list. Complete mandatory fields. Once completed, click OK. The tick remains and the yellow disappears as all mandatory information has been completed. Click Sign and the medication will drop off the list and reappear as and when due. PRNs will return to the list almost immediately. However, if you record given too soon after the last admission, the system will prompt to tell you. The order now shows as completed. The MAR chart now shows as given. Tests were ordered for the patient and you have taken a blood sample. You need to record that you have collected this from the patient. From Launch Point, select the activity you are recording. We are selecting labs. On the labs section, click on the document icon next to the relevant listing. Click on Document. Scan the patient wristband or click Unable to scan barcode. A list of orders awaiting collection appears. You can print labels from here by clicking on the printer icon. Tick the appropriate order you wish to print labels for. You can also select all at the top. Select your printer from the list. You can also set as default printer. Click Print. Click on the drop-down at the end of the order you are recording about. Click Collected. You can also print from here. Note, clicking Not Collected will cancel the order. Click Sign. The order has now fallen from the list. You can now close the window. Refresh the page. The order status now says Collected on the Orders page within Requests and Care Plans. We have now removed the IV that we recorded as inserting earlier. We need to record the removal details. Click Assessments and Fluid Balance. Select lines, drains and tubes from the navigator bands. Select peripheral IV access. Double-click to open the timeline. Once opened, the system will populate the date, time and how many days in situ. Input relevant details of the removal of the IV. Click the green tick to save the information. Information is now saved. We have recorded both the insertion and removal of the IV. You have now completed part 3 of the ED Doctors e-learning. Remember to also see parts 1, 2 and 4. Thank you.